Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're learning about a hands-on approach to care called Osteopathic Manipulative Treatment, or OMT. Next, we'll discuss the mission of Manna and how they're meeting the current challenges of food insecurity in our community. Finally, we're talking with members of an organization that's helping to bridge gaps in healthcare with vital funding for programs like ours at Council on Aging of West Florida. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Osteopathic Manipulative Treatment, or OMT, is a hands-on approach used by doctors of osteopathic medicine to diagnose, treat, and prevent illness or injury. Here to talk to us more about this topic is Heather Shanks, a primary care physician at Baptist Medical Group Primary Care Navarre. Thanks for joining me, Dr. Shanks.
Absolutely, it's a pleasure to be here.
So first of all, tell us, what is OMT?
Yeah, OMT, like you said, it's a hands-on approach where we systematically look at a patient and address areas of illness or dysfunction in areas that we feel like we can improve. It's based on 4 different tenets. The first one being that the body is created as a unit, right? We look at mind, body, and spirit. If one of those is affected, say spirit, like depression, it affects your body. You can have muscle aches, you can have constipation, you can have a lot of other issues, which all of that in turn affects how you work as a unit. The second tenet that we look at is the body is naturally able to heal itself. We have an innate ability to heal. So for instance, if you broke a bone, right, that bone would heal without intervention. That's just our body's innate way of healing. But the third tenet is where we look at form versus function. If something is out of place, then its function is going to be also out of place. So going back to that bone example, if a bone heals improperly without care, without resetting it, then the function is just not going to be the same. They're going to have a lot of problems from that. So we look at all of those together, and that's how we direct our treatment.
So it's a kind of whole looking at everything going on with the body working together.
Exactly. You know, we term it as a holistic approach. And sometimes I feel like people misunderstand that and think it's more homeopathic or naturopathic, but really it's just looking at the whole person.
That's why I kind of hesitated to use the word holistic, because I didn't know where you landed with that term.
Absolutely. And I'm glad that you brought that up.
So who can provide this kind of treatment?
So DOs provide osteopathic manipulative treatment. We go to school just like our colleagues MDs. We learn medicine, take all the pharmacology, physiology, and so on. But we have an additional anywhere from 200 to 500 hours of extra training on how to deliver OMT. It involves everything from learning more about anatomy, how the function of the body works. And I kind of like to tell people that what you can expect is more of a combination of things like physical therapy, massage therapy, as well as just overall anatomy.
So it literally is hands-on. You're putting your hands on, manipulating, and just getting in there with whatever the thing that you're treating is.
Yeah, the problem is, exactly.
Gotcha.
So more than just being able to run tests and give medicine, we're able to use our hands and feel those structures and feel that anatomy.
So how much does this kind of treatment typically cost?
So the good news is that it's an office visit. We do not charge anything extra. Insurance will typically cover any treatments, and a lot of times if it's planned ahead, we can see you in an office visit, but then we can also provide OMT during that same visit. I do have a lot of patients that will come specifically for OMT, but if you're there for a follow-up, say for your blood pressure or your diabetes, and you have something else going on, then typically I'm able to provide both services same day.
Excellent. So are there any side effects or contraindications for this type of treatment?
I'm glad you brought that up. So the only side effect that you can really anticipate is more of just soreness. So think of going to a gym, right? You went, you worked out, you worked some things that you probably haven't in a while. You can expect some muscle soreness. With OMT, it's not always passive, us just treating areas. A lot of times you're actually working with us. So you'll have some soreness, which is why we recommend making sure you stay hydrated. You can also take over-the-counter pain relievers such as Tylenol or ibuprofen to try to help some of that soreness, but typically that's the only side effect. Contraindications, the real contraindication is you don't want the treatment, so patient refusal. We're not going to provide a treatment that you don't want. But the other things are if you've had recent surgery and have an open wound or an incision, we won't be working on that area. If you have a recent or current fracture, we won't be working on that area. And different treatments, because we learn a vast amount, they have their own contraindications, but that's the beauty of it. We can always switch out one treatment for another to get the same results. So it really is a personalized individual plan per patient.
Okay, so who's a good candidate for this type of treatment?
Honestly, anyone. I've treated babies, I've treated toddlers, I've treated teenagers, pregnant women, the elderly, your typical run-of-the-mill person. Anyone can receive OMT treatment.
So what are some examples of conditions that OMT can help?
There's a lot, but I would say everything from headaches, sinus congestion, if you have areas that are having problems with lymphatic drainage, back pain, leg pain, you name it. I've even treated people who have like rheumatoid arthritis or osteoporosis. There's a lot of ways that we really look at improving the overall function of the body and enhancing that quality of life.
So talk me through something like sinus congestion. What exactly would you be doing?
Yeah, so that technique is called sinus effleurage, and the goal would be to break up areas of congestion, mostly in your face, in the frontal sinus and the maxillary sinuses, and being able to manipulate those areas to allow the lymph to drain right back into the system. That way it clears those sinus cavities and helps aid in congestion.
So there is this bit of massage to it, but it's with this physiological knowledge of exactly what's going on underneath and what's happening, that you can manipulate it from this touch.
Exactly. So that would be one of the ways that we do it is kind of like you stated, a massage in a way kind of fashion, being able just to move it around, which involves knowing the lymphatic system and how it drains and how to manipulate it in that way.
Gotcha. So how often should patients receive treatment?
Typically, you're not going to want to come every day, but I would say, about every 2 weeks. And sometimes, depending on what the problem is, you can be helped in 1 to 2 treatments. Especially for, I always give this example, men, I'm talking to you. If you wear your wallet in your back pocket, it can also cause your hips to be off, which causes gait abnormalities, which causes hip pain. So when we identify those root causes of why this is occurring, a lot of times you can be free of that. Other things, if they're chronic in nature, they've been there for a really long time, they can take a few more visits.
All right, well, thank you for sharing this with us.
Absolutely.
And, this is great information. I had never heard of this before, so I'm glad to learn more.
Well, I'm glad to talk about it. Thank you so much.
Stay with us. We're learning about how Manna is meeting the ongoing challenge of food insecurity in our community. Up next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram or go to aaflorida.org/volunteer.
Manna is a local grassroots organization fighting hunger in Escambia and Santa Rosa counties. Food insecurity has been top of mind for many with recent food assistance program delays and the holidays approaching. Today we're speaking with Manna's Executive Director DeDe Flounlacker about all the organization does and how you can get involved. Thanks for joining me today, DeDe.
Thank you, Emily, for inviting me.
So first of all, I'm sure many people know, but tell me about Manna, the organization, the mission, and how you fulfill that mission.
Absolutely. So we've been in the community over 4 decades, and we provide food in the form of groceries to people in need in Escambia and Santa Rosa counties. Last year, that was 71,005 people in need, and of that, 61% were children. So when we think about people who are hungry in our 2-county area, we have to think a lot about our children that are really challenged to have healthy food. And we also have to think about our seniors as well, which is a wonderful intersection of Council on Aging and Manna.
Absolutely, and I know we've partnered several times on different programs to make sure that our seniors that we serve are having all the food that they need and that are ready if there is some kind of emergency.
Absolutely, and we know that collaborations and combining resources is really the best way to fight this very complex issue of hunger. It is not a simple issue. You can't get from there to there, easily, and it's not a straight line. And so by working with other organizations who are doing case management or care management, then that gives us the opportunity to utilize the food as a resource that we give to that agency, who can then take a holistic look at what's going on with that client or their family, as opposed to just addressing one issue.
Absolutely. So we've all been hearing a lot about the SNAP benefit delays, what's been going on with the increased need for food, the increased food insecurity among all different populations. How has that affected your day-to-day? How are you meeting that need?
Well, I think through the whole month of November, we held our breaths just waiting for the next brick to fall. Mm-hmm. It has been a challenging couple of months in October and November. There are a lot of things that affected our local community. One was, of course, furloughed employees. So while the government was shut down, there were a number of people who continued to work. They had to, but they were not receiving a paycheck. So we worked with a couple of other organizations to actually be sure that a food distribution was done at Corey as well as Whiting. We provided about 9,000 pounds of food for each of those distributions, gave away somewhere around 450 bags of food with each distribution. And it was really important, Emily, it was really interesting too, because we did the Corey station first, and we saw a number of folks who were coming through who, as I said, were furloughed employees. Then when we did Whiting, it was just after November 1 when the freeze was put on food stamps, or actually known as SNAP. And that's when we saw a lot of people, but we saw a lot of active duty military who are also on SNAP. And we don't think about that. We have an image in our mind of who that person might be that needs help and might be on SNAP. And there is no stereotypical image that we should have, because it's a lot of different people. So we did a couple of special distributions in that case. We've really worked and expanded our partnerships. So we already have 18 programs that we work with 25 partners in Escambia and Santa Rosa counties. We also expanded those partnerships to do a further reach, trying to address gaps in service in Escambia and Santa Rosa. And then we actually, for our own pantry service, and I think this is one of the most startling statistics that I can share, we went from making 15 appointments per pantry service, so that's 15 families, to 60.
Wow.
That was for November. When we compare November 2024 to November 2023, that was a 378% increase in people for the pantry, and a 300% increase in pounds of food distributed just through the pantry.
Wow.
Yeah.
And I mean, it's great that you're able to distribute that much, but the fact that the need has grown that much is what it's actually showing us.
It is. In November, when we took a look at the whole month, we saw that actually our food distributions more than doubled over the previous year. And so about 95%, historically, about 95% of the food that we give away, because we never sell our food, the food we give away is actually from food donations from different organizations and faith-based groups from the general public. And so that's becoming a little more challenging as donations are dropping because of food prices.
I was going to ask, are donations increasing at this time when we're hearing so much about this?
Yeah, that's exactly what's happening. So, you know, in November we said this is a community crisis. It's not, you know, it's not isolated to one particular part of our country when we talk about SNAP benefits being frozen. And here there are about 61,000 people in Escambia and Santa Rosa counties that receive SNAP benefits. And so when you stop that resource for 61,000 people, it have a huge effect. Now what happened was what always happens, which we are blessed to live in such a great community. When Manna says we need, I almost don't have the words out of my mouth before people begin responding, which is just amazing. But what is going to happen, I'm very concerned about 2026 and what's going to be happening as it relates to SNAP and many other issues. Also, though, people get burned out after giving over and over, but one of the things that you and I both know is that people have to eat every day. You're feeding seniors all the time, every day. We're also feeding people every single day, and so food donations are needed year-round, not just around the holidays.
Absolutely. I know there's a drive going on at my daughter's school right now. We've sent some cans in with her there.
Yes.
And then also, I know you just had Fill the Mayflowers, so how did that event go?
Oh, it was great. You know, we saw more traffic at Fill the Mayflower this year than we have in years, and so it went really, really wonderful. We had folks from all different neighborhoods, driving all sorts of vehicles, some walking up to make food donations. We saw so many people, as we do, who will come up and say, Manna helped me a few years ago, or Manna helped me a few months ago, and now I want to return the favor. And you know, Emily, it might just be a can of food that they could give, but that can of food makes a difference, because when we combine it with all those other cans of food, it really helps build a bag of food. The one thing to note is that despite that being an incredibly successful drive, the food that we collected at Fill the Mayflower, it will likely be distributed by the end of January.
So before we wrap up, what is the highest need right now for Manna? What do you want people to know? What do you want people to do if they want to get involved?
Well, we'd love for people to go to our website at Manna Helps, so MANNAHELPS.org, and take a look at our most needed items. It tells you how to do a food drive on there. Also, you can make a contribution, a financial gift. For just $5, we can actually provide 3 healthy meals to someone in need. So making a financial gift is so important right now. It really helps us stretch the food. I think we're going to be doing a lot more food donations next year, and so we're really trying to build that up. The other thing is, if you're interested in volunteering, there's a way that you can sign up to volunteer. So that is a magical website to go to, is mannahelps.org.
Absolutely. Well, thank you so much for sharing this with us, and thank you for all you're doing with Manna.
Thank you, Emily.
Up next, we're talking with Covenant Health and Community Services about bridging healthcare gaps. Stay with us.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
Elmo's daddy taught him that when he has a big feeling like being frustrated, humming a song can help you feel better. Love your mind.
Covenant Health and Community Services recently provided $500,000 to Council on Aging of West Florida to address some immediate and longer-term needs at the agency to serve more seniors with in-home and community-based care. The organization established a funding committee after the sale of Covenant Hospice Services as a first step in becoming an organization that works with local health services providers to fill gaps and make healthcare services more accessible in Northwest Florida. We're talking to Chairman of the Board, Kent Skolrood, and Board Member Dickie Appleyard about the transformative efforts of this organization. Thank you both for joining me today.
Good to be here.
Thank you.
So to start off, tell us a little bit about Covenant Health and Community Services.
So thank you for the opportunity. Probably over 40 years ago, the two major hospital systems, Baptist Hospital and Sacred Heart Hospital, had identified a need to care for people who are terminally ill at end of life. And what's a respectful, compassionate way to provide that service? And so those two hospitals came together and formed and funded Covenant Hospice. And that's really how we got our start. We got our start through two community organizations coming together to change and improve healthcare. And then over the course of these last 40 years, that's exactly what we've done. We've had the opportunity that presented to us about 2 years ago to sell hospice and maintain that service, but just through that buyer's entity. And we thought about that long and hard. What's the greatest and best thing that we can do? Can we serve, a greater good by selling hospice and using those proceeds to improve healthcare in the community? So that's what we pursued. And we sold to Vitas. It's the entity that now runs hospice in middle of last year.
Mm-hmm. And so what prompted the effort to kind of use those funds to find those unmet needs?
So a lot of us, and Dickie knows this too, have heard about the unmet needs in the community. We get approached about that a lot. So a lot of the board members had been pressured by that. Covenant Care had been pressured by that. Can you do more? Can you do more? Can you do more? And quite honestly, the funding wasn't there. It's not there for the hospitals. It wasn't there for us. And so this unique opportunity by selling to Vitas and having these proceeds allowed us to look at what those needs are and pursue meeting those needs. Escambia County is not the healthiest county in the state of Florida. Florida's not the healthiest state in the country. So there are a tremendous number of unmet needs that we feel like need to be addressed. And so that's really what prompted a lot of this.
So how did the team kind of go about identifying the organizations? And of course, we're so grateful that you saw the need among seniors and identified Council on Aging as one of those organizations.
Dickie, you want to?
Well, what we did, we established a funding committee of board members and a few others from the community to do a needs assessment within the community. We were kind of, because of our roots, we focused primarily on seniors. Our goals were seniors and mental health needs in the community. And so we went around and met with probably about 15 different organizations, individuals who were involved and others to see what the needs were, what could be identified in our specific area, and it narrowed down to, for this short-term first funding effort of ours, that we identified 3 that we would work with, and Council on Aging was definitely one of them. We initially had thought that the 3 organizations would work together, and they did some diligent work to come up with a program, but the needs became so great in each of the organizations that we said, let's stop what we're doing on the big picture funding thing that might take more than a year, and let's find out what we can do right now to meet the needs of the community. And I would tell you that the easiest one was Council on Aging, because you had a definite need, immediate, and it was in feeding people. And so that was easy, and why you were the first one that received funding from us, because the need was there. Was pretty much promoted via you and others in the community, and we're so thrilled that we were able to meet the need of going from two meals a week to 5. So we're excited about what we were able to do.
Yeah, that was that immediate need of our dining site services. going from, they had gone down to 2 hot meals, 1 shelf-stable meal, when it had been 5 days of hot meals, and we are back up to 5 hot meals thanks to your funding.
Well, one of the other things we were excited about in your program was the long term, because your kitchen needed to be updated, and a part of your ask was to have the money to renovate the kitchen, which was very exciting for us because that will go on for years because you have a better kitchen to serve the different, better, bigger, whatever.
Absolutely.
So we're excited about that.
So that's the kitchen in our retreat adult daycare. We will be able to renovate that into a full commercial kitchen and then use it as our commissary. So it's a new funding stream for us as well, which is going to promote sustainability going generations into the future for the organization. So we love that, and we can't wait to get started on that work. What are some future plans for this organization's efforts?
You want to handle that?
I'll be happy to, but you're the chairman of the board. But right now, the first 3 that I talked about will be over. We're going through a transformation ourselves because we're a new organization with a long 40-year history of giving back. And so we're going through a strategic plan. There'll be organizational changes. We need to get the right people in place. This funding committee that I talked about, we're not professionals at funding, and there's a lot more need out there. So we need a staff and an organization that is set up to do funding and do the processes that people go through in order to make grants. And so I would say there will be more funding to come along. We got to get better at what we're doing so we do it properly and that we do it fairly and that we stay within our niche of helping mental health needs and the seniors of the community. We may expand that. I don't know what the strategic plan says, but right now that's where we are, and I can't wait to see where we grow to be and who we can help. Who knows? I will say that I think we primarily are limiting our philanthropic support to Escambia and Santa Rosa counties for now.
So this is only the beginning, but we're so happy that we're a part of it.
Well, there was no doubt. There was no doubt, and you all do great work, and we're excited to be a part of it. And one thing I have noticed is that the organizations work so well together within the community. We're lucky that it's not competition. It's a matter of how can we serve the most people.
Absolutely. Thank you both so much.
Thank you.
Thank you.
And thank you for watching. Until next time, enjoy life. You've earned it.